Today we shall be covering up hepatology and the remaining part of the gastroenterology. Initial, I have divided this class into two portions actually. Initially, there will be the first of we will be discussing the theory, just like we did the for the majority of the previous class. But then we have a lot of questions to discuss, question and answer to discuss. So mostly in the first the beginning of the class, our main target area will be hepatology, the approach to it, and actually from where we finished the last day class, from there we shall start. But there will be few things, few information. If those are missing, we shall discuss them during the question answer thing. So my approach to my sincere request to all of you will be just like the previous class. If you wish, you can write down the notes at the same time so that you can have a good amount of revision of most of the things. So we will be starting where we finished the last day, that is the acute pancreatitis. Today we have a lot of questions regarding acute pancreatitis. Then we will be discussing regarding the scores that we use in acute pancreatitis. But here just a recapitulation that what actually the causes of acute pancreatitis, where it was the last topic of last day. So in UK, mostly the question will come that in UK you are an SHO, like we have discussed that day. So gallstone and alcohol, these are the two most important cause of pancreatitis, acute pancreatitis in UK. But there are other causes like trauma, steroids, mumps, autoimmune disease, ascaris, scorpion venom, hypertriglyceridemia, hyperchylomicronemia, hypercalcemia, hypothermia, and very importantly, ERCP. Remember, ERCP, as per the Mrcp Part 1 examination, the most common complication of ERCP procedure is acute pancreatitis. There are questions on this, and there are a number of drugs which are associated with acute pancreatitis, as we have mentioned last day, of which of note, because this information will again be helpful during solving the question answer, is the mesalazine. You must remember this one, that mesalazine is extremely important for creating or causing acute pancreatitis, and it is 7 times more harmful in this term than sulfasalazine. However, we will discuss the side effects of sulfasalazine and mesalazine as we move into the question answer pattern. And another part that I couldn't finish the last day, there is the Hearthstone disease. Basically, this is the rectal variant of the achalasia, simply that. It's again another enteric nervous system dysfunctional disease. So it happens because of the developmental failure of both myoenteric and Meissner plexus. Myoenteric and Meissner plexus and it is a developmental or congenital disease. So it is mostly present in childhood. So patient present with constipation in childhood. Remember one thing, we are going to write an exam on internal medicine. So mostly there will be no question that will come up from pediatrics. That is very important. But occasionally, why childhood diseases are important, you need not know too much about them, but why most the diseases that have more implication on in childhood are important, because they can come as a statement in a question. So mostly childhood diseases, their importance in Mrcp Part 1 will be, maximally they would be just one statement over there. So another issue with of Hearthstone disease, which is exam point of view, which is important, that is it is associated with Down syndrome. So occasionally it is again a statement. Apart from that, not too much is required to know about this. So now we are moving into the hepatology. That is our basic discussion point of discussion today. So this is exam oriented approach. It's a concise approach that I am going to go through for the hepatology. So hepatology, I have divided in like this. So initially I will have an approach of condition and the exam oriented features which are important in those conditions, various hepatic disorder. Then we will move to the approach to LFT with normal values of LFT. Again, you need to remember, because the units they use in UK are different from the units in biochemical tests that we use in India. So many times we face a problem with the units. Suppose they are using millimole, we are using mg percentage. So this is again a problem. So in my class, I shall also provide you the normal values in their units. That is also very important, because sometimes just for not knowing the unit, you might miss a question. Another thing that I wish to pressurize over here, occasionally in the exam setting, on your day of exam, it might happen that suddenly a question has come which has a biochemical list of examination with their values, and their values are in their international unit per liter or like that in their terms basically, and you are unsure about it. Remember one thing, there might be high chance, suppose this is suppose that test is LFT and you are not sure what is the value of GGTE, normal value of GGT in their terms. So don't be panicked. Occasionally what happens in the total whole exam paper, there is a fair chance that there might be another question which contains the normal value in the range of the same thing. So before, in such scenario, suppose you experience a question like this in the beginning, just wait, go through the complete the paper. Just keep in mind that I have to search for LFT values, LFT table, wherever it is present in the exam. So there is a high chance that you can come back to that question which was unsolved in the initial part of the exam, and you can solve it better. So this one you just remember, occasionally common sense pay a lot basically. So hepatology, so exam oriented. To first is viral hepatitis. Normally in the questions of viral hepatitis, they will discuss about, they will inform us about the foreign travel and recreational IV drug user or recreational drug user. These terms might be there. We have to search from them. And regarding the features of viral hepatitis, mostly they will talk about the malaise and vomiting, anorexia, myalgia, right upper quadrant thing. All these are generalized. Just for recapitulation, we have to go through. So once we have done this, then there is another term is congestive hepatomegaly, which is mostly present in other cases when the cardiac output is low, or maybe there is tricuspid regurgitation, or maybe congestive cardiac failure is there. So here, most important thing, which is important in congestive hepatomegaly, it is that the liver will be tender. So they will say there will be right upper quadrant tenderness, and there will be liver pain, because whenever there is a stretching of liver capsule due to any reason, maybe due to primary cause, maybe due to all overload scenario, there will be some painful tender hepatomegaly. This one you need to remember. Then you will go back to the causes of that in the exam. Now, after this, we are coming to the third condition of the day, that is biliary colic. Again, mostly they will say about the right upper quadrant pain, and there is extremely important that post-meal attack, the pain increases after the person takes a meal, a heavy meal. They will use this kind of terms. There will be nausea, and there will be the kind of pain will be colicky pain, which is suddenly coming up, and gradually after a few a moment, or gradually after some time, maybe 1 hour, half an hour or so, that is getting relieved. So these are the terms we need to find out. As the last day also I mentioned that this is a complete word-based exam. There will be no picture, no sound, nothing, only words. So you need to understand the keywords. Keywords you need to, that is the difference from the day-to-day clinical practice to this exam. Definitely the experience from clinical practice is important. Along with memory, you need to point out on the keywords. Now coming back to acute cholecystitis, the Murphy sign might be plus over there, and we all know about the Murphy sign. Suppose sometimes, or they can say that Murphy sign, sometimes they can say that the right upper quadrant was tender or tender on palpation, like that, or patient catches his inspiration on pressing the right upper quadrant of the abdomen. And the pain, acute cholecystitis, will be severe. Remember one thing, as per Mrcp exam, acute cholecystitis, if there is symptomatic or symptomatic gallstone, we should go for surgical intervention. If there is no symptomatic, asymptomatic gallstone, we should not go for anything if it is in the gallbladder. If the stone is down or distally in the CBD, then again we should go for the surgical option. I will discuss it again in the exam, in the question answer time. Then we are coming to the ascending cholangitis. Normally, ascending cholangitis contains the fever with rigor is mostly present. So again, right upper quadrant pain, jaundice will be there, and this is mostly secondary to gallstone. Again, in the exam, they will tell that USG was showing some gallstone, this or stone in gallbladder, and CBD infection. Again, USG cannot look at CBD, so further tests we need to go for those things. Now we are coming to Gallstone Alias. This Gallstone Alias is basically due to the there is a fistula and that happens between gallbladder and the intestine. Mostly the gallbladder is gangrenous, so that's why the fistula has been formed between the porous or between the deficient membrane of the gallbladder and the intestine, and gallstone is impacted in the intestine. Now, coming to the cholangiocarcinoma, this is very important from exam point of view. We need to remember this. So, in cholangiocarcinoma, we'll find a palpable mass in the right upper quadrant. This is extremely important. Then we can also find Sister Mary Joseph nodes. That is this one is very popular. This term, Sister Mary Joseph, these are nothing but periumbilical lymph nodes which are present in case of cholangiocarcinoma. We can find the Vichos node on the left subclavicular left supraclavicular region, and we can also find the persistent biliary colic, anorexia, jaundice, and a history of significant weight loss. So whenever they will say palpable mass right upper quadrant and Sister Mary Joseph node, there is high probability that they are talking about the cholangiocarcinoma. This question, this number 7, is extremely important. We will also cover them in the question answer pattern. And acute pancreatitis, again, let me recapitulate here. The most common two causes in UK is alcohol and gallstone. And there are two important signs which are not very frequent in all the cases of acute pancreatitis in clinical setup. But for exam, again, important one is the Cullen sign, which is the periumbilical discoloration that is found, and that another is the Gretarner sign, which is found in the flunk, which is basically the flunk, abdominal flunk discoloration. So these two, again, important, because if these two are present, then in exam, the answer will surely be the acute pancreatitis. Now we are coming to the pancreatic carcinoma. Classically, pancreatic carcinoma will be presenting with painless jaundice as per exam. So this one is for exam, but in practice, pain may be present, pain may not be present. There are occasionally some other confounding factors also in the pathophysiology, but for exam purpose, you must look if there is painless jaundice. That is most probably they are pointing towards the pancreatic carcinoma. There will also be anorexia definitely and weight loss significantly. And we are coming to the amoebic liver abscess. So typically they will call about malaise, anorexia, and weight loss. But remember, jaundice is uncommon in amoebic liver abscess. So this is also very important from exam point of view. This kind of questions like painless jaundice in pancreatic carcinoma or absence of jaundice classically in amoebic liver abscess, these are important to as exclusion criteria. So they will say that least likely to be present. So the answer will be this kind of jaundice. So you remember these things for exam point of view. Painless jaundice, if you are going through, so that should be to the pancreatic carcinoma, or jaundice that is uncommon in amoebic liver abscess. These are important for exam point of view.